Hey guys! It's weirdly quiet here because I'm super early, but I just kind of got started on my dental journey. You know how people do fitness journeys? Well, I'm taking care of my mouth now. So on Monday, I got a root canal. It is now Wednesday, and I'm still swollen. I've got a little bruising going on down here, but I survived it. The endodontist was super nice, and everyone working at the office that I went to was super nice. And I got the root canal. I have a temporary filling in right now, so I've got to go back to Aspen to get a crown fitted in a couple weeks, so that can be done with. And then I've got gingivitis treatment to go through, which is common. I'm not that disgusting, but I am pretty disgusting. And then quite a lot of money and fillings to do. The plan is, once I get all my fillings done and everything else situated, I want to get Invisalign or something similar to help straighten out my jaggy teeth, and hopefully in a few years' time I will be happy with my smile again. I will keep you guys updated. This is gonna be just one long video kind of about that whole thing, or maybe it'll be a series so I actually have stuff to upload. But if you're curious about a root canal therapy procedure, first, your root canal is actually just part of your teeth. It's the part where your roots are and where all the nerves and stuff are. When you need to get root canal therapy is whenever you get a cavity or an infection in your tooth. It completely eats all your nerves out of your teeth, because the bacteria that's in there creates an acid. So basically, bacteria shit is acidic, so that's cool. I also have a piece of my actual jaw that has degraded because of the bacteria, and that's gross. But there's an 80% chance that that's going to be repaired on its own after that. But a root canal, if you have to get one, or if you ever have to get one in the future, you're going to hear a lot of scary stuff from other people. I'm here to debunk that. Getting it done, the process was so simple. Always do your research beforehand so you know what's going on. But I went into the endodontist, and they took me into a chair. They did some x-rays to see how the tooth is shaped and how everything is going in there, to see what they have to do. And once they get you all situated, depending on your dentist, they will offer you, can't think of the gas right now, but laughing gas. And if you're an adult, they just make it to where you feel like you've just had a glass of wine, just enough to relax you, which is super perfect for me because I have really bad dental anxiety. Like, just talking about it right now is making me nervous. But once you get relaxed and they start numbing you, numbing is the worst part. The worst part is the numbing. And then once your numbing's in, I have issues because sometimes local anesthetic has to be reapplied to me because it wears off really quick, or I'm just really resilient to it for some reason. And the worst part of the numbing is that bear with me, this is disgusting and makes me want to throw up just thinking about it. They take this big ass needle, they shove it down the center of your tooth to numb the inside of it. That's the most painful part. But once that's in there, you're good. Put little goggles on you. They put a dental dam in, which is like a little piece of rubber that they just fit around your tooth to keep everything clean and stuff. And I didn't have my eyes open during this part because stuff like that freaks me out, but they use a little tiny rotary bit to file the inside of your tooth just to clean everything out. They use a rinsing agent to clean everything out. And once they're done with that, they get these little tiny, they almost look like little silicone cones. I don't know what they're made out of, but they look and smell like silicone. And they stick those in your roots to fill it up. They heat that up, take the little tags out, and then they put in a temporary filling, which I was giggling at this point because I had my eyes open. I was watching him put the cones in through the reflection and the magnifier. And the temporary filling stuff comes in what looks like a glue gun. And I was giggling in my head because I'm like, they're hot gluing my tooth together. Laughing gas is something, I'll tell you that. But they're so nice. If you can, ask them if you can listen to a podcast or some music, because that really helps. My phone wasn't registering my headphones as existing, so I didn't end up getting to do that. But it was actually okay. It was an interesting process. I'm glad I did research beforehand so I knew what to expect. And yeah, so don't be scared if you have to go get a root canal. I am a little B word when it comes to pain. So day one, like immediately after the root canal, I was a little sore, but there was still some numbing going on, so I didn't really feel it all. Yesterday I was in pain. Yesterday I ended up crying because I couldn't manage my pain with Advil. And I waited too late to call the endodontist to see if he could put in a prescription for something. And yeah, this morning, after my Advil, I feel so much better. My tooth is still a little tender, which that's gonna happen because they were drilling it. And yeah, I feel a lot better today. I'm actually at work, about to go clock in. I should probably stop recording, but yeah, if you ever go get a have to go get a root canal, I recommend it. They're ridiculously expensive, so keep that in mind. But it's not as scary as you think it's going to be. The filling part, when they're doing all the stuff, all you feel is a little bit of vibration, if you even feel that. It's not bad at all. Now, the bruising and stuff, I could do without. It would be cool if that just hurried up and went away. But I've been using saltwater rinses, been brushing my teeth, flossing, taking care of that area, and it seems to be helping. So, that's it for this video. Thank you for watching. If you want to learn more about all the dental crap I have to go through, or just follow along my daily life, please subscribe if you liked this video, if you found it informative. Please like it. If you want to be notified when I actually upload, which isn't very often, hit the bell. And I will see you guys next time. Thanks for watching, and hopefully this may have eased your mind a little bit. Alright, bye-bye!